Seniors, I'm begging you, learn these face stroke symptoms before it's too late. Seniors, have you ever looked closely at your face in the mirror and asked yourself, is my smile still whole today? You might think that a slightly drooping lip, a sagging eyelid, or a flat expression on your forehead is nothing more than a sign of aging. But the terrifying truth is, many strokes begin with these tiny changes, and by the time they're noticed, it's often too late. Can you be sure that the next time your face looks different, it's only fatigue and not a stroke knocking at the door? Picture this. You're sitting with your spouse, sipping tea, chatting like any other day. But when they smile, one side of their mouth doesn't rise like it should. They keep talking, telling you they're fine, yet their face is already crying out for help. If that moment came, would you be alert enough to recognize it and act immediately? Or would you assume they were just tired and decide to wait? If you've always believed that strokes begin only with weak arms, shaky legs, or slurred speech, you're about to be surprised. Because in the next part, I'll show you why the face, not the arms or legs, is often the very first alarm when a stroke strikes. Are you curious to know why a tiny change in facial expression can mean the difference between life and death? Have you ever wondered why emergency doctors always check the patient's face first, not their hands or legs? The reason is simple yet urgent. Our facial muscles are controlled by extremely short nerve pathways with virtually no backup routes. Just one small clot can block the blood vessel, and the signal from the brain to the facial muscles is cut instantly. Isn't it frightening to think that just a few minutes of oxygen loss can cause one side of the face to fall out of control? Meanwhile, the arm and leg muscles usually have more supporting nerve pathways, so their reaction is slightly slower. This means that before your arm weakens or your steps falter, your face has already sent the alarm. But how many people truly recognize this? Haven't you too thought that stroke only shows when a person can no longer walk? Recognizing the earliest facial signs is not only important, it is the key to survival. And in the next part, I'll show you the 4 clearest facial signs that anyone can detect with just a glance. So, are you ready to discover how a crooked smile, a drooping eyelid, or a flat forehead can actually save a life? Sign 1. Crooked smile. Before I show you the first sign, remember this important truth. Just 1 second of early recognition can save an entire life. So, if you find this video helpful, please hit the subscribe button right now so you won't miss information that could save you or your loved ones. And drop a comment below. Type 1 if you believe this is truly important, or type 0 if you think it's not necessary yet. I want to know where you stand in your journey of protecting your health. Now, try smiling. Normally, when we smile, both corners of the mouth lift evenly, forming a balanced smile. But when a stroke begins, one side of the mouth no longer receives signals from the brain. The result is a crooked smile. One side rises while the other droops. Have you ever seen someone still talking, still insisting, "I'm fine," but when they smile, their face no longer looks the same? Would you be sharp enough to realize this isn't shyness, but the brain crying for help every single second? The reason is simple. Each hemisphere of the brain controls the opposite side of the face. When one side of the brain loses blood supply, the facial muscles on the other side immediately weaken. The patient feels no pain, no numbness, nothing unusual except for a distorted smile. And it is precisely this silence that causes millions to ignore it. Do you think that this no pain factor might actually be the most dangerous trap? Never forget, the smile is the brain's most honest mirror, and if it becomes crooked, never ignore it. But this is only one of the facial warning signs. What about the eyes and the cheeks? If they suddenly droop, could that also be a signal you must not overlook? Sign 2. Drooping eyelid or cheek. Have you ever looked at a loved one's face and suddenly felt something seemed off, as if one cheek had sagged or one eyelid appeared slower and heavier than the other? Many people would think it's probably just lack of sleep or just fatigue, but the reality is far more frightening. This could be the brain losing control. Have you ever wondered if that small change might be the very moment that decides between life and lifelong disability? In stroke, when the brain's cortex that controls facial muscles is deprived of blood, nerve signals no longer reach those muscles. The result? The cheek and muscles around the eye lose tone, looking limp and lifeless. The patient doesn't feel pain, doesn't complain. Only their silent face betrays the truth. Isn't it chilling to realize that such a tiny change could mean an entire region of the brain has gone dark? The sad truth is, many people over 60 are used to blaming these changes on aging. Droopy eyelids, sagging cheeks, just tired. But the face doesn't lie. When one side droops, it is not normal aging. And if you ignore it, the brain will continue losing millions of cells. Would you dare to wait longer just because you think it's nothing? But the eyelid or cheek is not the only part that reveals the brain's distress. There is a simple test that anyone can do right away. Purse your lips or try blowing gently. If one side of the mouth doesn't close properly and air escapes unevenly to one side, that is a stroke signal you must not ignore. Are you curious to know why such a small action can expose a stroke from its very first moment? Sign 3. Inability to move one side of the mouth when pursing lips or speaking. Have you ever asked a loved one to purse their lips tightly or blow gently as if whistling? If they cannot fully close one side of their mouth, or if the breath escapes unevenly to one side, this is no joke. It may be a silent warning that half of the brain controlling the mouth muscles has already stopped working. Do you think just one crooked breath could be enough to announce an oncoming stroke? In stroke, when the part of the cortex responsible for fine motor control around the mouth loses blood supply, the patient loses the ability to coordinate the lips, cheeks, and tongue. They can still talk, but their speech will sound distorted, slurred, or unclear, easily mistaken for drunkenness or simple fatigue. Even pronouncing simple sounds like puh or buh, one side of the mouth hardly moves. Have you ever heard someone suddenly slur their words for a few minutes and thought, maybe they're just thirsty? But what if it was a stroke at that very moment? The danger is that this sign is often mistaken for tiredness, lack of sleep, or even alcohol. But if you're attentive, just noticing an unsealed lip or distorted speech is enough to recognize the brain's SOS. Are you sure that the next time you hear someone stumble over their words, you won't dismiss it? And there is still another sign, subtle but highly reliable. When frowning or wrinkling the forehead, only one side responds while the other stays still. Have you ever thought that your forehead wrinkles could actually be the brain's signal board?
Sign 4. Uneven ability to wrinkle the forehead or frown. Have you ever considered that the wrinkles on your forehead could save your life? Most people pay attention to smiles or eyes, but the forehead is often the brain's earliest signal board when a stroke occurs. So, are you ready to try frowning right now as a quick check? Under normal conditions, when we wrinkle our forehead or frown, both sides react evenly. But during a stroke, one side of the forehead becomes smooth with no wrinkles, while the other side still works. This is a highly reliable sign because it points to damage in the brain itself, not just in peripheral nerves. Isn't it fascinating that a smooth, flat forehead on one side can distinguish between a benign issue and a dangerous stroke? The sad part is that the forehead is often overlooked. People notice the lips, the eyes, the voice, but forget that the forehead is the silent zone that often speaks first when the brain loses its signal. Have you ever dismissed a flat, expressionless forehead thinking it was just part of aging? All 4 facial signs, a crooked smile, a drooping eyelid or cheek, an unsealed lip when pursed, and an uneven forehead may appear for only a few minutes, then vanish. But if you ignore them, the golden opportunity to prevent permanent damage disappears as well. So why is the face the very first place to send an alarm and not the arms or legs? And what really happens in the brain that makes the face distort within just the first 3 to 5 minutes? Brain mechanism. Why the face changes first. Have you ever wondered why the face changes before the arms or legs weaken? The answer lies within the brain itself. Imagine the brain as a command center, sending signals to every part of the body. The region that controls the facial muscles sits right on the brain's surface and is supplied by the middle cerebral artery, one of the vessels most prone to blockage. Isn't it alarming that the very area allowing us to smile, speak, or wrinkle our brows is also one of the easiest targets? What makes it even more critical is that the pathway from the brain to the facial muscles is extremely short and solitary, without backup routes like those for the arms or legs. That's why even a tiny blood clot can instantly cut off the signal, and the face loses control immediately. Within the first 3 to 5 minutes of a stroke, you may see a crooked smile or a drooping eyelid before the patient feels heavy arms or unsteady steps. Doesn't it send chills down your spine to realize how quickly everything can change before you even have time to react? The important thing to understand is that the face is not just for smiling or showing emotions, it is also the brain's earliest alarm bell. And when that bell rings, you do not have the luxury of delay. But here lies a major problem. Many people confuse stroke with another condition called facial nerve palsy or Bell's palsy. So how can you quickly tell the difference when one can heal on its own, but the other is life-threatening?
Distinguishing stroke from Bell's palsy. One thing that confuses many older adults is not knowing whether a drooping face is due to stroke or simply Bell's palsy. Have you ever heard someone say, "Don't worry, it's just a chill, it will go away in a few weeks"? But would you really bet your life on that assumption? The difference lies in speed and scope. Stroke usually strikes extremely fast, within minutes, and often affects only the lower half of the face. The patient may also have slurred speech or weakness in an arm or leg. In contrast, Bell's palsy develops more slowly, sometimes over several hours, and typically paralyzes the entire side of the face from forehead to chin. But it does not affect the limbs. Can you see how just a few seconds of careful observation could separate two conditions that seem alike at first glance? The key lesson is this: if you're not sure, always treat it as a stroke and call emergency services immediately. Better to be mistaken and saved in time than to wait in false hope and lose everything. Do you agree that caution at this critical moment could mean the difference between recovery and lifelong disability? The consequences of delay and the golden time. Did you know that during a stroke, your brain loses nearly 1.9 million neurons every single minute? That means if you hesitate for just 10 minutes, more than 19 million brain cells are gone, cells that will never grow back. Isn't it terrifying to realize that every tick of the clock could mean a piece of your memory, your speech, or your independence disappearing forever? If you recognize the signs within the first 0 to 5 minutes, the face will already have begun to change. A crooked mouth, a drooping eyelid. But if you wait another 10 minutes, the patient may begin to slur their words, their eyes turn vacant, their mind becomes confused. Wait 20 minutes and tens of millions of brain cells die, leaving the patient unable to move an arm or a leg. And if you wait more than 30 minutes without calling emergency services, the risk of death or permanent disability doubles. Would you really gamble your entire future just because you thought maybe it's fine to wait a little longer? Another problem, especially in the US, is that so many older adults live alone. Without someone nearby to notice changes, facial warning signs are often overlooked. A 78-year-old woman in Illinois lived by herself and only called 911 5 hours later when her hand felt numb. When paramedics arrived, they saw her face had already been drooping for hours. Doesn't it make you realize that living alone doesn't just mean loneliness, it can also mean losing your chance to survive? And then there is a deeply rooted habit across generations, the culture of endurance. People think, it will pass, tomorrow will be better. But stroke never waits until tomorrow. Many patients admitted they tried to endure it, tried to wait it out, and by the time they reached the hospital, it was too late. Have you ever let this habit of endurance turn into your own enemy?
Another simple but fatal reason? Not knowing the early signs of stroke. Nearly 1/3 of Americans over 60 don't know that a crooked face or slurred speech is a warning sign. If you don't know, you won't suspect, and if you don't suspect, you won't act. Doesn't that make knowledge the most important weapon you should arm yourself with today? Many people also choose to self-diagnose instead of calling emergency services. They think it's just low blood pressure, poor sleep, or even just a chill. Some even search Google before dialing 911. But while you are searching, brain cells are still dying. Do you really think the internet can replace an emergency doctor? And finally, the deepest reason? They don't believe it can happen to them. They eat well, exercise, had normal blood pressure yesterday, so when their face suddenly droops, they deny it. But stroke doesn't choose only the weak or the sick. It can strike anyone. Have you ever thought that next time it could be you? These are the 10 most common reasons people ignore facial signs of stroke. But the important thing is, once you know them, you will never look at your own face the same way again. So how do you turn this awareness into action? And what are the simple steps you can take to save your life the moment the first symptom appears? What to do when you notice early signs? So when you notice a crooked smile, a drooping eyelid, distorted speech, or a forehead that won't move, what should you do? Many people choose to sit and wait, drink water, or lie down, but that is a deadly mistake. The only thing you must do is act immediately. Do you agree that even 1 minute of hesitation can cost you part of your life? For those living alone, post a stroke warning checklist on your bathroom mirror or refrigerator. Each morning, when you look in the mirror, try smiling, pursing your lips, frowning, and watching carefully. If something looks off, take action. Do you see how a small piece of paper on the mirror could become your own life-saving alarm bell? For families with elderly loved ones, share this video or put a reminder board up in the house. Don't be afraid of bothering your children or neighbors, because making one false alarm is harmless, but being late just once could cost everything. Wouldn't you rather your grandchildren see you healthy every day instead of helpless in a hospital bed? Most importantly, remember that stroke almost never announces itself with pain. It is silent, cold, and ruthless. But you are not powerless. You can change the outcome simply by recognizing and acting at the right time. So how do we turn fear into hope, moving from anxiety to confidence that we still hold the key to our own health? If you remember only one thing from this video, let it be this: a crooked smile is never just nothing. A drooping eyelid is never just tiredness, and a flat forehead is never just aging. These may be your brain's cry for help, and only you can hear it. Are you ready to become the hero for yourself and for your family? And now, if you found this video helpful, please hit like and share it with someone you love, because one day they might need this information more than anything. And don't forget to subscribe so I can keep walking alongside you as a trusted friend, giving you more chances each time to protect your health and your hope.